Hi, my name is Valerie Ballou, and I'm going to be doing my AED video today. So first thing, when we're coming to a scene, we want to make sure the scene is safe. The scene is safe, as we can see. Next, we're going to get a pulse and check his breathing to determine what form of treatment we're going to do. We're also going to see if we can wake him up, see maybe if he's asleep, find out his level of consciousness, or LOC, and then we will go from there. Right, Daniel! Hey, Daniel! Help! Help! You'll check pulse and breathing for at most 10 seconds, and what we find there, we determine what treatment we're going to do. So if he doesn't have a pulse and is not breathing, we perform CPR. If he does have a pulse but is not breathing, we perform rescue breathing. So for this situation, he is not breathing and does not have a pulse, so we're going to go ahead and go into CPR. So for CPR, we're going to do 30 compressions to 2 breaths. The 30 compressions will be at 100 beats per minute approximately. So we already did that. Now what we're going to do is go into using our AED. First thing we do with the AED is we turn it on. It's usually the big green button or big red button. It's pretty simple. Next, what we do is we will place the pads on. If just depending on the person, they may be really hairy, so you may have to shave off some of their hair. So in this situation, he's not. Also, too, when we're placing the pads on, we want to make sure that they're in a dry, safe area. If it's wet, it won't charge as well and could cause other injuries. So now we're going to go ahead and place the pads. And then from here, we tell everyone to stand clear, and including myself. We don't want anyone touching him or anyone really near him, because that could the AED could read our pulse versus his pulse. So, and then from here, it'll prompt us to hit shock. Shock's usually a big red button with kind of like an electrical sign. And then from there, we'll press that. It'll reread. It'll tell us either to keep performing chest compressions, shock again, or that there's a pulse. And from there, after that, we'll keep performing this and keep following the AED's instructions and chest compressions until either the ambulance arrived, which we would have called once we figured out that there was no pulse and there was no breathing. That's when we would have called 911. And so we keep performing CPR and keep using the AED until EMS arrived and go from there. Or we would stop if his pulse came back and his breathing came back. And from there, we would just monitor his signs and symptoms, monitor his vitals, and hopefully everything will turn out okay and he will make it. But that's the end of my AED video.